Good afternoon. I am Rachael Wells. I am a licensed mental health counselor. I am EMDR certified, and I am very passionate about this topic that we'll be discussing today. So Pineapple Support has put on a Survivors of Suicide discussion as we are in Suicide Prevention Month. And as we get close to the holidays, this issue becomes a little bit closer to home at times. So I am not going to do a PowerPoint, which I sometimes do. We're just going to kind of chat about different topics. My hope is to answer any questions that people will have and to discuss the topic in a very frank, real, and respectful way. So this topic is something that I'm sure you already know with having signed up or seen the title, can and perhaps will be triggering in ways. So I encourage you to kind of center yourself, take a moment, see if this is the right time and place for you, and know that if there's anything that I can do to better explain or discuss, just ask me. So I have no doubt that this will bring up some feelings, and we're going to work through it as we discuss. So I hope to, I guess, dispel some myths about suicidality and provide some hope and healing to people that have survived loss by suicide. So with that, if there's no questions or needs or anything as we begin, I am going to start tackling the cycle of grief. So I'm imagining, whether you're in America, England, Europe, anywhere across the world, that you have some familiarity with the grief cycle or cycles of grief, or the Kubler-Ross kind of method. That is the way that we've looked at grief for many, many years. And although it provides an excellent starting point, it's not really the whole story. And I have had many individuals state that sometimes they feel some sense of confusion or guilt because this doesn't really match their experience. So that's important to look at, because with something that's so big and heavy, when we're seeking help for grief, if we're finding things that don't match with us, we can often start feeling strange or wrong, or very alone, most likely. So I wanted to share that really, when we're looking at the cycles of grief, we're starting to finally look at it a bit differently and reinvigorate it and have it actually match up with how we really do feel. Because this linear experience of, denial and anger and things like that, they don't really match quite everyone. So I'm going to share something that I found that I wanted to share with you all that probably visually makes a little bit more sense. So, because it can be kind of hard to find. You look up grief cycle and you're going to see step 1, 2, 3, 4, 5. Well, for those of us that have grieved, especially grieved sudden traumatic death, like suicide loss, it's not very linear, because there's really not much more that could be as unexpected. There's different ways of grieving. So for a grief that is expected and prolonged, like someone who may be, in hospice care, that is a certain type of grief where you're more the captive audience to watching someone's pain and regression. There's a type of prolonged loss in that. When it comes to sudden tragic losses, that's another type of grief. in all styles of grief can we loop back around and re-experience. But very much so with suicide loss, I see what we see here. You go backwards, you repeat stages. That's normal. You can go through most of this cycle in a day or a week, to be quite honest. That's how humans really are. So there is no shame in not grieving correctly. I really want to dispel this idea that there's a proper way to grieve. And I'd also like to challenge the terminology of complicated bereavement, which is an actual diagnosis, not one of the big ones, but a diagnosis that can be thrown onto people that are grieving for too long or in a way that is not publicly acceptable, which is maybe being very open about grieving. So just looking at this, I just want you to, whether you screenshot this or, this is available to see later, or you look it up. These things can all happen. These things can happen a year after suicide loss. They can happen 5 years, 10 years. You can experience, 4 or 5 of these experiences 20 years down the road. What I will say about grief is that the intensity and the prolonged experience of a grief episode does shorten. But this idea that one day will just be full of acceptance regarding a tragic loss like suicide loss or any loss, no. And that can sound, I know some people might feel validated by that, and yet others might be like, okay, so this is a longer journey than I signed up for. But please know, just like anything that we suffer and struggle through, it doesn't take up as much space in your life, the painful piece. But the person is always a part of your life. Your relationship to them never stops, at least in my way of thinking about things. What I want to focus on with this is the validity of all these experiences shown here. Avoiding, I don't want to talk about that. It's not affecting me. I'm okay, whatever. Being angry at the person for perhaps leaving us behind or leaving us with a burden of feeling guilt or shame about what we could have done to keep them around. Feeling like we're just skating through life. And then we start the dialogue of feeling more empowered and finding a way to respect that person's life and take in all that they've taught us and left with us and spreading it. Almost like the seeds of everything that we experienced with them, we want to spread their memory. So I'll pull this down. So yes, I just wanted to kind of take on that view that I don't believe in complicated bereavement or grieving improperly. How can there be such a thing? We have to remember that with anything living, like a human who dies by suicide, that is perhaps months, years, decades of memories and experiences. So to expect someone to be over it on their bereavement leave or in a month or an extended stay, we know that doesn't make sense deep down inside, but we're told differently because our westernized society tends to practice numbness and avoidance. And we kind of preach that as a way to, keep people from not talking about challenging things. But we know that doesn't actually work. Deep down in there, we know that's not quite right. So talking about suicide with others. I'm going to be kind of jumping around to different topics, just so you know. But talking about suicide with others. There's a lot of myths that if you ask someone, do you want to kill or harm yourself, which I always recommend, we're told as therapists, you must ask point blank, not do you want to pass away? Are you thinking of, harming? Like, we got to get really clear and to the point about some of these issues. So if you're with someone, I know we're talking about loss today, but just for knowledge about the truth around suicide is that it does not encourage anybody when you ask them. Believe me, that thought's already been on their mind. The fact that someone's willing to be frank with them and actually say the words, kill yourself, hurt yourself, often you'll be opening up a door of, I can talk to this person. They're not going to judge me for the harsh realities of life that I'm experiencing. It doesn't plant a seed in their mind to want to do it more or to move forward with it. That's a really, really toxic belief that has somehow been created in society, that if we talk about it, it makes it so. It does not. We know this is happening, and this is happening more frequently, especially with the isolation of what's going on with the pandemic and has been going on. We're dealing with the impact of isolation and fear and being left to really our own devices, not having sounding boards. If our only sounding board is our own brain, and our own brain is feeding us garbage, which it truly is, that is what happens when we have, misfires in our brain. That is how the brain works. It fixates on the negative, and when we have mental health issues or we're having a low time, it really starts heavily feeding us escapism, which can be through suicide. So I just wanted to get that out of the way. But when we're discussing suicide of the loss with others, so if you are seeking support for the loss that you've had of someone that died by suicide, you don't have any obligations. So some people are like, I don't have the energy to talk about that. A lot of people will unfortunately try to live vicariously or feed off of something. They want to hear about how it happened, what was the person's story about how it happened, and unfortunately are not actually seeking to conversate with you or console you about your loss, but just trying to get the details. So you have no obligation to share with anybody if it's a story that grabs the media's attention, or a lot of people in your community know about it, or even just the worried well. You don't have to tell anybody anything you don't want to. You can set a boundary of, I'm not comfortable discussing this. However, it has been found research-wise that it can be important to talk about the cause of death with people that you really trust and love, as opposed to my friend passed away or something like that. Being very upfront about how it happened will help the people that love you care for you, because they'll understand this is a tragic death that is a little more complex than, average expectations, life and death expectations. But I was really promoting there the people that you trust. Because remember, your story is really a gift. It takes your energy, it takes your time, it takes your vulnerability. So we only give that to people that we know can take that and build it into support. So moving on to some challenges. I want to really discuss the challenges of being a survivor of suicide loss, which I myself am multiple times over, which unfortunately is common if you're really in any community. Many communities are hit hard by this, especially those that are marginalized. So this may not be a first time experience for those of you hearing this and watching this. So I want to go over some challenges and some things that can help us move forward in a way that is respectful to us and the person or people that have died by suicide. And you'll notice I'm saying died by suicide. That is considered a more respectful term in the community of people who have lost those to suicide, because committing suicide is still considered a term that is associated with criminality, that is a crime to have done so. And neither us nor the people that have passed away are associated with any sort of criminality. This is a crisis, mental health and societal health. Okay, so some of our challenges. I'll talk about two of the big ones that I've really noticed. Is when you've already gone through that loss, you'll really find out some interesting information about your community and your inner circle. Most people, really no fault of their own, this is just kind of how society works, again, with the avoidance and the numbing, will have what we consider poor reactions to grief. They might offer platitudes like, it'll be okay, they're in a better place, God got another angel, something like that. And as we hear that, we might be kind of like, ooh, that doesn't give me a good feeling. No, it doesn't. Most of these people, I will say, their intent is not to be hurtful or dismissive, but the impact is hurtful and dismissive. So most people do not know how to talk about grief. They may try to have you push your feelings to the side, focus on them, focus on toxic positivity, which is going past negativity and going all the way past neutrality and objectivity over to toxic positivity, where everything is all right, it's always going to be okay, when sometimes it's just not okay. These are what people learn from their families and society. So in those spaces, unfortunately, we don't really have the day-to-day energy we would to empathize and understand, okay, this is about them, not me, when we're grieving. And sometimes it'll be too much. Some people come on too heavy with perhaps religious beliefs that we don't hold, or toxic positivity or dismissiveness. And in that place, it's okay to pull back. It's okay to set boundaries and encourage people. I appreciate you helping in any way you can. But when we're discussing this, I need a listening ear. I need to be pointed in the right direction. I need resources. So normalizing asking for what we need while really trying to cultivate the people that are in tune with us. Because a lot of times with grief, especially suicide loss, where a lot of people can be curious about how it happened or why it happened, we almost feel like we have to put on a performance, and I'm going to get real practical here. We may be the person that's involved in having to identify a body or pass that to someone else that's better suited, which is okay. It does have to happen. We may be the person that has to talk to the community or deal with, funerals or wakes or stuff like that. And it can really feel like a performance. you'll notice that many times at funerals and wakes and celebrations of life, that it's hard to cry and to feel. Almost kind of like we dress up, and a lot of people have said it's very dissociative for them. They don't feel like they're actually there. They're just kind of moving through the motions. So know your limits. And when you hit them, try to trust your gut. Gut will tell you. You'll know, maybe not logically, but you'll know somewhere in your body that something is going to prolong your grieving journey in a way that is hurtful to you. So what I'm really trying to say here is stick with your true friends. Unfortunately, you will notice that some people maybe can't hang when things get really hard and life gets very real. And that can be an extra trauma and an extra grief while we're already in very dark depths. But I like to talk about it because I want to be real with you all about things that can happen, and not to scare or to invite anything like that, but to talk about what many of us have gone through. That some people just, they're too much in their behavioral patterns. They can't be present for us when we're in pain. That doesn't mean that they don't want to, it just, they don't know how. And sometimes we can't support that. Another challenge I like to discuss is suicide running in families. This is a scary one. I don't like to mention it, but again, with being real and practical here, it does happen. So this is why when we discuss ways to help ourselves, that is crucial to get the help that we need and to rely on those that we trust, or find people that we hope we can trust, and start to reach out for support, even if it doesn't feel safe or normal for us to do, because it's really a pandemic in its own way, suicide running in families. And there is really no fault in this statistic. No one wants to cause pain. When someone dies by suicide, the intention is to not cause pain to somebody. That is not the thought. And we'll be discussing that in just a moment. But unfortunately, the pain does get passed on and on and on. So kind of like breaking the cycle of trauma in our own families, this may be another cycle that we have to coach ourselves to break through, following some of the recommendations that we'll discuss, as difficult as it is. Grief is isolating in and of itself. So before we get on to those recommendations, I did want to discuss briefly the headspace of someone who is suicidal. If you have been suicidal, there may be more of a route for you to understand. When you think about when you've been in those spaces, what's going on in your mind. Most of the time when we're thinking about those that we love in a suicidal state, it is love and mercy. A lot of people that have survived suicide attempts will say, I was thinking I am doing them the best thing I could do. Because if you truly and deeply see yourself as a burden, an extra mouth to feed, someone that's got too many problems, somebody that's not worth anything, if that is your true, deep-seated belief, then you think you are actually doing someone a mercy. And that is the mindset when we feel that way. It's not logical or rational. We have to begin understanding that even the parts of planning and completing suicide that seem rational, like when people have come to accept what's going to happen and they seem happy and at peace, getting rid of belongings, making plans, that's still not logical. That part of the brain has been completely hijacked, basically, by really challenging depression or trauma or both. So in part of our healing journey, and it may be years down the road, helping ourselves to build empathy for that person. They were not trying to hurt anybody. They thought that they were doing something for the good of the earth and their family and the community. And they felt like that was their only way. We know this isn't logical, but that's not how mental health works. There's not a lot of logic to what our brain pumps out when it's either genetically, dealing with genetic depression that's been passed down for generations, or it's been fed such toxic and low self-esteem type thoughts from abusers of society or people that are judgmental. That becomes your template. And the voice that you're hearing in your head, you think is your own, even though it's the conglomeration of people that are spreading and projecting hate that they already have in their heart. So just something to think about as you're on your healing journey, just starting it in the middle, wherever you are. Now we're going to get into some of those recommendations for healing. And some of them are going to be pretty practical. Some of them are going to be emotional. We'll kind of track wherever we need to go. So the first and perhaps most important thing is something I touched on earlier, which are let the people in your inner circle help in the ways they know how. Sometimes this is as practical as, can you bring me to my doctor's appointment? Can you join my therapy session? Can you help me set up grocery delivery? Can we go to the park together? Can you come shopping with me? Sometimes, if we think of the love languages, if you're familiar, some people will respond with spending a lot of quality time with you. Some people will give you lots of words of affirmation and support. Some people are going to be dropping gifts and food at your door. Some people are going to want to cook and clean and shop for you. And some people are going to want to hug and hold and support you, watch movies with you. So a combination of that and letting people know what you need can be very powerful, because we're still living. We still got the basic junk that we have to do sometimes. Just the logistical stuff of the day in and day out, and just having someone there to be beside you is powerful in and of itself. And it takes real strength for our friends and community to say, I don't know how to talk about grief, but I want to be with you and I want to support you. That can be very healing in and of itself. Another recommendation is seeking help. And I know this might already put people off, like, I don't know. And I know we're here with Pineapple Support today, who obviously really recommends and has strengthened the community through therapists and listeners and providers. But some of us may still be a little hesitant about that. But seeking help with someone specializing in grief, especially suicide bereavement grief, which I believe it might only be for the US. But I know if you look up the American Foundation for Suicide Prevention, they actually do have a full spreadsheet list you can access of people that have completed their suicide bereavement course that are licensed or registered therapists. Because there's nothing worse than someone coming to you saying, I've never been able to process my grief, or I've been with therapists who don't know how to talk about this. It happens in therapists too. Sometimes therapists are offering toxic positivity or avoidance or distraction. That just prolongs our suffering. It really does. After the initial brunt of the pain of suicide loss, that depth of avoidance no longer helps us. So we need someone that knows how to talk about this and isn't afraid to discuss suicidality and grief and the nitty-gritty of our feelings and what happened with the person who died. So seeking that out, that can be a helpful recommendation. Also, there's many sites where you can seek for therapists, and it'll say specialty or accommodation, and you can look for grief and loss. This doesn't always make for sure that they're going to be an excellent grief counselor, but it's an excellent place to start. And also through Pineapple, that is a topic that many people have stated that is part of their specialty. So that could make them easier to find as well if you're looking in their little biographical description. And if seeing someone one-on-one is not right for you, there are support groups, which I know is another thing that some people are like, I've had my time with that. There are grief support groups, which I've worked with survivors of suicide loss, survivors of homicide loss, all types of loss, and it seems like specificity is best. So there are, again, with the American Foundation for Suicide Prevention, they do have survivors of suicide loss support groups that are offered. They are usually run by someone who has lost someone, not exactly by a therapist, so more community-led groups. But sometimes the specificity can help, because if you're in a general grief group and you're the only person that survived a suicide loss, or at least that's what they're discussing, it can feel isolating, and no one wants to reach out for help and then feel silenced or misunderstood. So my best encouragement there could be do your research and know that if you visit a group, as sensitive as it is, just like with a recovery group, you do not have to commit to anything because you walked in the door or you logged onto the Zoom. We might have some people-pleasing tendencies that may want to keep us there, but again, that'll only prolong our suffering. And word of mouth always helps. If you know people that have survived suicide loss, ask them what has worked for them along the way. Another option can be medications. Hold, please, while I explain what I mean by that. So, medications when it comes to therapy and mental health, sometimes there are some people that need that long-term or lifelong. That may be for any number of issues. And there are some people that would benefit from having psychiatric medications for perhaps a couple of months. The point of this psychiatrically is to get someone to a point where their anxiety or their depression or their mood stability can be brought to a level where they can successfully discuss their grief. So if we are so anxious that we can't even get into the therapy door, or we sit there and we keep avoiding the topic, even though we know we need to talk about it, or we're so depressed and we feel like when we start talking about it with a counselor or a friend, that we can't even get our words out. That is what medication for adjustment issues can help with. So this doesn't mean, oh my God, now I'm on these long term or for my whole life. It's meant to help you get to a place where you can get your story out and work through healing, and then perhaps you wean off. So that is a completely normal and valid experience because oftentimes our own symptoms we already had rise up, or complete new experiences of symptoms like anxiety and fear and depression and lonesomeness come up from suicide loss. Another one that I think sometimes we forget is finding places to go or be when we are deeper in one of our grief episodes. These are episodes where it can be really red on our face. We need to cry and mourn. We need to be alone. We need to just do whatever it is we need to do. Kind of scoping out these places in your life. A lot of times people would talk about in surviving suicide loss, I need to have a place at work where I can just kind of run and cry. That might be the bathroom in the building over. That might be an unattended room, something like that. I think what can really instill anxiety in us is knowing that when those emotions start to spill over, and it's in a place where that might not be accommodated or accepted or understood as well, that there's somewhere that we can go and just be authentic. So that's a kind of practical little tool and tip, but it can be very helpful to just know I'm not trapped with this if it needs to come out, and it does need to come out. Ritualizations. This is something I've worked on with a lot of grieving clients. Is we can tend to ritualize holidays or important days. And I mean more negative ritualization. Like we almost expect that day is going to be bad. I'm going to feel awful. I have to stay at home. I'm not saying go to work. I'm just saying, I have to stay at home. I'm going to be in bed. It's going to suck. I hear that a lot. And I always heavily recommend creating different rituals. For instance, if it's Christmas and you hate Christmas, or you feel like you hate Christmas because that's when a suicide loss occurred, that doesn't mean that you have to join your extended family and this big hubbub, but it also doesn't mean that we have to be bedbound and extremely depressed. It could mean that we get Chinese food with a friend, we cry it out, and we watch a movie and we do something in their memory. We light a candle for them at a spiritual establishment or at our home. We read out their name, we read a poem that reminds us. We go visit a place they enjoyed. We plant a tree, a flower, anything that has to do with them that can be uplifting. So it can be different. I really like to inspire people to think outside the box, because I have seen these ritualizations become very painful for people when they've kept them up for years, expecting this day has to be bad. I'm not saying that it's going to be joyous, but that we can perhaps have an element of reflection and respect for, again, ourselves and the person who passed. So doing something that promotes life can be really special. And that's why I mentioned growing, planting, visiting, volunteering, and making sure that we eat and we're hydrated, and or doing something that maybe they would enjoy or used with us. And using some of that reflective acceptance in a way. This can be quite challenging on a death date passing. So I know that those can be a little different, but something similar we can do. Another thing, which often has more to do with our community, as in their willingness to bring up these topics, is really using their name and talking about them with others. Many times we want to do this, but we feel we shouldn't, or it's going to bum people out. I should be over this, should. Don't shit on me. Something I always say in therapy. Should has not done anything for us. Again, it will reflect on the people in your life if they refuse to allow you to discuss someone who's passed away. But using their name is really powerful. I've seen amazing things happen with clients and friends and family when you just say, tell me about Ben. Wow, that sounds amazing. What did you used to do together? Can you tell me a story of your favorite time? A lot of times we think we're going to be triggering and irritating. I'm trying to kind of play both sides as the person with the loss and the person discussing the loss with someone. It's okay to talk about people. That's the best way to promote acceptance and healing. They are still very much real to us. Perhaps we were their mother or father, aunt, uncle, sister, best friend, partner. You are still those things. It's not feeding into anything to talk about someone and share stories. I think any one of us would want that, no matter how we passed away, for people to laugh and joke and smile and think about stuff we used to do together and how we used to be, and quirks and jokes. That's what memory is. So use their name because it's not a bad word. And one of my last things I wanted to mention before we start wrapping up and maybe have some time for questions is these are things that are going to happen, but it's good to challenge ourselves. So the biggest question when we're usually in a low state of our own depression when handling suicide loss is the question why. It is so painful and so never ending. It never seems to leave. But what I found is that you are going to come up with a lot of possibilities, but you will not come up with a conclusion. And that's the trick of ruminating and the why question. That's why people call it playing an old tape again. We think we're going to hear something different or find a secret code in there about exactly why this happened. But you will never know the final conclusion because we can't have been with that person inside their mind as them. The why question is our mind's way of, unfortunately, accidentally torturing us. I think most of us have known that when we've gone on the why spiral, we don't get too much out of it. We usually walk away feeling worse. So it can be good to question. Okay, I find myself asking why again. I know this hasn't led to answers before. I appreciate that part of me wants to seek an answer out of respect and diligence for my loved one, but I know where this has gotten me before. So whenever we do have reactions that we know don't help us in the long run, please be compassionate with yourself as best as you can. No one is trying to irritate or harm or prolong anything. Most of us we're just looking for answers. That's our human nature. We want answers, and we're seeking them in the best way we know how. And our brain goes a little haywire with that. And then the concepts of guilt and shame. So guilt is an emotion that is felt by everyone across the world. It is a naturally occurring human emotion in the emotions that we all feel. Guilt, although not enjoyable to experience, can promote movement and growth. And just hear me out. That might sound weird in the context of what we're discussing. So guilt sometimes can be helpful. Like we'll be like, okay, I know that was something I did wrong. Now let me fix it. When it comes to suicide loss, it is often not helpful at all. And what I really want to focus on is shame, which is never, ever helpful. It is actually not a naturally occurring human emotion. It is created by humans. It's taught to one another. There's a difference between I did something I'm not happy with and I'm a bad person. This one doesn't motivate us to do anything. It keeps us in a cycle of deep depression and self-loathing. The fact that we might feel those upon a loss occurring, especially one such as tragic as suicide, is not the problem. So you might be like, well, I felt it. There's nothing I can do about that. You're exactly right. However, feeding these emotions of guilt and shame, that's where we have to gently put a stop to it, because what feeling guilt and shame are, what the brain is trying to do, remember, most of this is just the brain. It's not inner us and what we actually want and need. The brain is hoping for a sense of control, because losing someone to suicide is one of the most uncontrollable experiences. There's nothing that can be done for the person that was lost. We don't know what to do. We have lots of questions, no answers. It's a shock to the system. So the brain seeks out control. That's usually what self-blame is about. Well, I could have done this. In that upsetting feeling is unfortunately a sense of control. I can take some blame for this, so I can shoulder some of it. So that means at least this much was in control. But it's not, and this sense of powerlessness is very frightening to feel, especially if we've dealt with powerless issues in the past. It's something to challenge and to discuss. There's nothing more that we could have done. And we are never, in any situation, how could we be expected to predict anything tragic? These thoughts of, oh, I could have said this, I could have done that. Sure. But when we're living our day-to-day normal life expecting the usual, we're not preparing for death or suicide. So the guilt or shame, it certainly doesn't help us, and it doesn't help the memory of the person that we lost. So in essence, what I really want to communicate to everyone out of everything we've discussed is the important way to come to an acceptance, not of that I accept that this happened and I like it, but that this is a part of my story, is a sense of dignity for you and them. So a sense of dignity for us is by treating ourselves with gentle kindness, like we would if someone came to us with the same issue. I highly doubt most of us, if someone came to us as a survivor of suicide loss, would say, just move on, you're dealing with this too long, no, I can't help you, whatever, I'm just being ignorant. We wouldn't do that, but that's how we act with ourselves, because remember, we're the only odd one out, but we're not. And we're not alone in this. This is an experience that is very wide, but not discussed. So the resources are there. And they are going to look different for everyone, what helps them on their journey to healing. But let it always have a sense of dignity and respect for you and the person that you lost, or the people that you have lost. So with that, I will always recommend Pineapple Support for those in America, American Foundation for Suicide Prevention. For seeking any other type of therapy if you need, there's Psychology Today that can also help you find certain groups. Pineapple is really a one-stop shop in that they've got their therapists, they've got support groups, and they've got listeners. So take what you need and be dignified in doing that, because you deserve that. So, pausing there, I know I've been a motor mouth. I hope that what I've shared has been helpful and real and practical for you. And if you have any questions or needs, I'm always available now and many times, as with anything, school, work, life. If a question or concern comes to you later, it is always okay to email Pineapple Support. They have always gotten it to me and I always get back, usually within 24 hours. So it is no bother to me. I'm very humbled and happy when people reach out, because that lets me know that it's kind of percolating in there. So if anyone has any questions or comments, go ahead. We have the Q&A box. We also, I believe, can use the chat box. So whatever you need to do is fine with me. And I know this has been recorded. Some folks might be hearing this later, which I encourage you even months down the line. If you have a question, please ask. We're here to support you. But other than that, thank you for joining me.